Hey everyone, welcome to the Canine Culture Podcast, where we talk about everything dog. Q&As with veterinarian professionals, rescue operators, everyday topics. We cover everything dog on this podcast. So make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media on both Instagram and Facebook. Thanks again for listening. Now here's that next episode. Hey everyone, welcome to the Canine Culture Podcast. This is your host, Brittany, and we are joined today by Terry Fossum. She is a veterinarian, but more specifically a veterinary surgeon, also an author. And so today we're going to talk about some common surgeries and just some different things to kind of educate the listeners on surgeries for dogs. So Terry, thank you for joining us.
Oh, thank you for having me.
Tell us a little bit about yourself personally and professionally.
Okay. Terry Fossum. I have been a veterinarian for about 40 years, so a long time. What I did is I grew up around cattle ranching and horses, and went to veterinary school, did my undergrad in Idaho at the University of Idaho, and then went to Washington State to veterinary school. And I really thought I was going to be a large animal veterinarian. But I fell in love with surgery. And so after veterinary school, I did a 1-year internship in Santa Cruz, California. And then I went on and did a 3-year surgical residency at the Ohio State University in Columbus.
Go Buckeyes.
Yeah, go Buckeyes. And then moved to Texas and was on the faculty for many years. I now live in Arizona. I originally came out and worked for a university here in the Phoenix area that was starting a new veterinary school. And now what I actually do is I have started my own company, and we are making natural medications for really kind of unmet medical niches. So we have a drug for canine cognitive dysfunction in dogs. We sell some really high-end CBD products. We're working on an anti-itch product right now. So I've sort of turned from many animals to helping a single animal with surgery, oftentimes, to trying to help many animals with diseases. So, but it's fun. It's a wonderful profession.
Yeah, so you've seen everything. You've seen the wide gamut, even dabbling in large animal a little bit. But for dogs, you and I were talking before we got started about how there are specialties in vet med very much similar to human medicine. You know, you've got you've got surgeons, you've got specialists. And so a lot of dog owners have no idea. Maybe even some fellow vets don't even know that certain professions exist. So as far as being a surgeon, were you kind of spanning the whole gamut of like any surgery, or does that get even more specialized whenever you're a surgeon?
Yeah, that's a great question. So I'm going to expand upon the different specialties, because I think it's really important that people understand that we have general practitioners who have done their 4 years of veterinary school, and then they practice. And they're usually excellent practitioners. Some are better than others, but they're very good. But there's another layer, and that is specialty veterinary medicine. And so for that, we have everything from veterinary dermatologists. My husband's a veterinary cardiologist. I'm surgeon, ophthalmologist, neurologist, pretty much internal medicine, you name it, we have that specialty. And so when things get tough, you really might want to ask for a referral to a specialist, because there are a lot of things that are really outside of a general practitioner's normal daily care. So they will, if you ask, they will refer you. And that's oftentimes a good idea, to at least get another opinion on it. As far as surgery goes, so our surgery training is fairly broad. In that we learn orthopedics and soft tissue and even some neurologic surgery like back surgery.
Hmm.
But generally what happens is that people find what they really like. And so, especially if you go into academics, there's generally an opportunity to say, only do soft tissue surgery, which would be chest and abdomen,
Hmm.
or only do orthopedics, only do bones, or only do neurosurgery. But a lot of specialists in private specialty practice do everything. So it just depends on what you do. I do soft tissue surgery. I did that from day one and really did very little orthopedic and neurosurgery after I finished my training.
Would soft tissue encompass like if a dog had a larger mass that needed to be removed that was maybe a little bit more invasive, something like that?
Yeah, so soft tissue I know is kind of a weird term, and we don't actually typically have a specialist that say only does gastric surgery or only does heart surgery or only does intestinal surgery. We usually, when you're a soft tissue surgeon, you do thoracic cavity and abdominal cavity. So that would be removing masses on the skin. That would be removing masses in the abdomen, to be doing heart surgery, whatever. We generally do all of that if you're a soft tissue surgeon.
Okay. Yeah, and this is important to understand for dog owners because, as we were talking about, if you do get a diagnosis, maybe your vet says, you know what, nothing I can do, just put, little Remy on some Rimadyl and some meloxicam and let's call it a day. Whereas if you go to a specialist, if you know about a specialist, if you know that that's out there, you can actually go get that opinion or ask for that second opinion. So I do
Yeah,
think it's helpful to know about this.
it is really important. And just to give you an idea, so I'm a soft tissue surgeon. I don't do orthopedics. I haven't done it in years, and I won't do it. And I have an 8-month-old Labrador puppy that needed to have his elbow scoped the other day. He has a condition called elbow dysplasia,
Hmm.
and he's lame. And I wasn't going to do that. That's not what I do. I took him to an orthopedic surgeon to have
Right.
it done. So even as a specialist, I'm very careful about the specialists that my dog sees, and I make sure that they're, have the right training.
Hmm. I never thought about elbow dysplasia. You always hear hip dysplasia, you never hear elbow. That's interesting.
Yeah, unfortunately, Labradors do get elbow dysplasia quite a bit, and it's a developmental, condition that they're born with, and
Mm-hmm.
so and some dogs don't show lameness early on. Some do. Mine did, unfortunately. My We're Labrador people. I just lost my 14-year-old Labrador, and
Sorry to hear
he
that.
had elbow dysplasia as well. And when he got older, it was really tough to
Hmm.
manage him because he also had kidney disease. So we couldn't put him on any nonsteroidals.
Right.
Nonsteroidals are really hard, as you may know, because you mentioned a couple there,
Yeah.
are really hard on the kidneys and GI tract of dogs. And because he had chronic kidney disease, I couldn't use them. And so it was really hard to manage him. So the
Hmm.
last thing I wanted was another puppy with elbow dysplasia. But I love this dog. So he's mine and he'll get whatever
Yeah.
care he needs forever.
Right. Yeah. We're a Pomeranian household. And so luxating patellas, that's high on the list of what we see every day, and some
Yes.
hip dysplasia, and then, trachea issues forever. So yeah, it's kind of funny how even if you treat the dog differently, even if they've got a different genetic background or whatever it might be, these little issues still might pop up with those predispositions.
Oh, we definitely, so I have two sons and they are both physicians
Uh-huh.
and human physicians.
Uh-huh.
And I always tell them that a lot of times I can pretty much get a diagnosis based on the history and knowing the signalment, what we call the signalment of a dog. So if I know their age, their breed, and their gender, and I get their history, I can oftentimes tell you what it is because a lot of the diseases are very specific to breeds,
Hmm.
or the breed may have high prevalence of a certain disease. So yeah, it's really when you have a certain breed, you know what diseases they get. You
Yeah.
mentioned tracheal collapse is a problem in Pomeranians and Yorkies, small breed dogs. that I do surgery on a fair amount.
Oh,
So,
wow. Okay. All right. So let's kind of jump in then. Let's talk about, and this is a very broad topic, so this could go any way, but the five most common surgeries. And so let's just kind of go in order. It can be any order. It doesn't have to be, most seen surgery to least, but let's talk about what are those five surgeries you see the most?
okay, so, but let's keep in mind that the surgeries that I would see are going to be very
Right.
different than a general practitioner would see. So
Right.
let's talk first about, because most people are going to go to their general practitioner initially, at least.
Hmm.
So let's talk about what they see the most. And probably the number one thing that they see are skin masses. And they're oftentimes small because people see them.
Hmm.
And so they'll take them in and they can be removed generally pretty easily, sometimes with just a little punch biopsy, which is just like a little circular cutting device, or a scalpel. And then they may or may not even suture it, depending on how big it was and how deep they had to go. So those are really easy,
Hmm.
and probably the most common thing that gets done. But let's talk about even their post-operative care can be really important.
Hmm.
So, if you've ever been under an anesthetic or been sedated, you know that you're sort of wiped for a while. And
Hmm.
dogs are too. Dogs will be wiped out for a while. So when you get them, you pick them up, take them home. Don't leave them in your car for a while and go do your shopping. Take them home, get them comfortable, put them in a place where they can't move around a lot. Especially if your veterinarian has said restrict their exercise. This means keeping them in an area where they can't maybe jump on the bed if they're used to getting on the bed.
Hmm.
If they absolutely insist on, say, sleeping on the bed, buy or build them a ramp so they can go up and down it while your veterinarian has asked you to do exercise restriction. Um, just make them as comfortable as you can, but generally within a day, they're going to be back to their normal self. And
Hmm.
there's probably, very little aftercare. There may be sutures to remove.
Hmm.
Generally, those get removed between 10 and 14 days. So your veterinarian is going to ask you to come back, generally. Now, sometimes we do use absorbable sutures, and your veterinarian may say, I don't need to see you again unless you have a problem.
Hmm.
So I think bumps, small masses, bumps are probably the number one thing
Hmm.
that that veterinarians see.
And
If
do
you're
you think it?
asking, the other thing I wanted to mention, I think is really important,
Hmm.
is let's talk about spaying and neutering, or spaying castration. The general term would be neutering, so spaying
Hmm.
females, castrating males, neutering for both. Let's talk about that one because that's obviously a very common surgery and it's one typically done by general practitioners. And we've always, what I was taught when I was in school is, let's say for females, you want to spay them early to reduce or even prevent them from being able to get mammary tumors, or as they get older, getting infections in their uterus, which we call pyometra.
Hmm.
So we always recommended neutering early. And at one point, we a lot of shelters would not, still will not release a dog to an owner unless they've been neutered,
Right.
which meant that they were keeping these animals longer before they could adopt them out. And people want to adopt puppies and kittens. And so we as a group, veterinarians started doing what we called early neutering. So it was
Hmm.
like, 8 to 12 weeks of age. And what we noticed is that we were worried about a number of things, but what we saw for sure was that their growth plates didn't close as early, and so these animals were taller than, say, a litter mate that hadn't been neutered early. And we worried about things like would their urethra grow, would they have issues with urination, things of that nature. A very interesting study came out a few years ago from the University of California at Davis. And what they did is they looked at 35 different breeds and the impact of the timing of neutering on a number of different things: joint disease,
Hmm.
cancers, incidence of cancers, and incidence of urinary incontinence, which again, we always thought was probably related to early neutering, but didn't really know. And that study came out with some really interesting information. And what they did, well, I think, see if I can find it. They put together, let's see if you can. So they put together this little sheet. And
Hmm.
what it does, I know you can't read it, but what it does is it tells you by breed when they recommend neutering. And so some animals doesn't matter. And generally small breeds and joint disease doesn't matter when you neuter
Hmm.
them. Bigger breeds, it actually, some breeds, it does have a pretty big effect. And there's even a few breeds where they will tell you, mainly really because of the incidence of cancer, to not neuter them until they're at least 2 years of age. So it really varies. We have everything from it's okay at 6 months of age on up to don't do it until a year. And then a few, at least one breed, two breeds, don't do it until they're 2 years old. So that was a really important study and
Hmm.
one I think worth taking a look at for your specific breed.
Yeah, I had this conversation with someone the other day. So I work a lot in the shelter system. I work with the shelter and a few rescues. And um, I mean, we preach spay and neuter, spay and neuter, spay and neuter because we are just so overrun and overwhelmed.
Yeah.
However, there's a difference in spaying and neutering for population control versus for health. And I had always been of that other older mindset of as early as possible, it will prevent different types of cancers, especially in female dogs. But
Right.
someone said, well, if you were to read this study a little more closely, you would understand like, sure, their risk of certain cancers of reproductive organs go down. However, the incidence of cancer like lymphomas and other types of cancers actually increase.
Goes up.
Yeah. And so that was really eye-opening to me. And that's actually something newer that I'm even learning about because I have realized quite a few vets are still kind of that older mindset. Like, yeah, just, spay and neuter as early as possible. There's no issues and they won't get cancer. And that's just not really the case anymore.
No, and that's why I wanted to mention this paper because I think a lot of people haven't read it. It's interesting. I was talking to a veterinary oncologist the other day, getting a friend's dog in to see her, and I asked her about this, and she wasn't really familiar with this paper even. So it
Hmm.
is something that pet owners need to be aware of because they may actually need to educate their veterinarians about
Right.
this. So the group out of Davis that did this 35 dogs, they're doing additional dog breeds now.
Okay.
So there should be another paper coming out
Great.
sometime in the next year or two, I would think, hopefully.
Yeah.
But it's a great paper and really interesting information.
Yeah, absolutely. And we can, people always fail to recognize that as a surgery. We're like, oh, just fix your dog. But I mean, it's a surgery and it's quite common. I mean, obviously, I'd hope it's common, whether it's at an early age or a later age. So we can certainly classify that under like the five most common.
Oh, I
Well,
think it probably would be one of the five most common. So let's talk about what that means. And you say these because you're right. I mean, people think, oh, I'm just going to go in and have my dog fixed. It's no big deal.
mhm,
But if you have a female dog, we make an incision, typically in the mid abdomen, and we reach in and experience will actually dictate how big that incision needs to be. People have done this a lot, can usually do it through a smaller incision. But we reach in, we find the ovaries, we clamp that, we remove the ovary, and usually the uterus, both. Some people leave the ovary and just take the uterus, but usually I've always done both. And
mhm,
then you close it up. So there is an incision, and you're going to want to take care of that incision. So your veterinarian is going to tell you to check it, at least initially, check it twice a day for redness, swelling, discharge, pain, sutures. Make sure the sutures, if there's sutures present, that they are intact. They may send your dog home with either, you've probably seen those, what we call Elizabethan collars or cones the big plastic ones. There are also
Yeah.
inflatable ones now that are a
Hmm.
little better, or even, clothes, suits that dogs can wear that will keep them away from their incision. It is very important that you not let them lick and chew because they will lick out their sutures, and they
Hmm.
do that pretty quickly, and they'll make a mess of the incision, which may require it being resutured. So, be careful of that. When you get your dog home from the spay, they can have access to water. So before surgery, your veterinarian is probably going to ask you not to feed them the night before.
Hmm.
And that's because we don't want food in their stomach when they're anesthetized, because if they vomit any of that food up, they could aspirate it down into their lungs and get aspiration pneumonia, which
Hmm.
is very difficult to treat, and dogs can even die. So we don't want them to have any food, but generally water is okay. So pull the food usually about 10 o'clock at night or midnight, and keep them off food until you take them in the veterinarian. When you get them home, they may or may not want a small amount to eat right after the surgery. If you're taking them home the day after the surgery, they're probably going to want to eat. If it's the
Hmm.
same day, they may or may not. If they don't want to eat at all, give them, maybe warm their food a little bit. If that goes on for very long, talk to your veterinarian. We do have, there are drugs that we can give that will increase the appetite. Or there may be something wrong, and that may
Hmm.
be the reason your dog isn't eating. And so I'd say within 24 hours, if your dog is not eating and drinking normally, I
Hmm.
would contact a veterinarian. The other thing you want to watch for when you take them home is to make sure that they're urinating okay. They're probably not going to defecate for a day or two because they were off food, but they should urinate. And so you want to make sure they don't have any issues there. And then make sure that if your veterinarian has given you any medications, that you give them appropriately.
Hmm.
And do not forget to come back for those rechecks. They are so important. Veterinarians are overwhelmed right now, and I can guarantee you they're not going to make an appointment for you unless they really believe that your dog needs to be seen. So if they
Right.
have made you an appointment and tell you to come back, please do that. It will be
Hmm.
in your dog's or cat's best interest.
So let's talk about third most common surgery. What do you have under that one?
For me, as a soft tissue surgeon, it would either be removing masses from the abdomen, so spleen, liver, occasionally kidney, but a spleen, we see a lot of cancers in the spleen of dogs,
Hmm.
especially big dogs. The third or fourth, the other one would be what we call foreign bodies. So anything that animals eat that will obstruct them. And I tell you, some dogs in particular will eat anything.
Hmm.
My 8-month-old puppy never looks at if something drops on the ground, he's going to eat it.
Yeah.
And he's like horrible about that. So we see foreign bodies that are causing issues. It may cause vomiting, diarrhea, a total obstruction of the intestines. And so we go in and there are two ways that we can remove those. One is surgically. We make a surgeon in the abdomen, incision in the abdomen. Or sometimes we can remove things, depending on where they're located in the GI tract, just with a scope.
Okay.
So there wouldn't be a surgery. And,
Hmm.
we talked a little bit about cardiac, that there are
Hmm.
veterinary cardiologists. I told you my husband is one.
Hmm.
To give you an example of in veterinary medicine, just like in human medicine, I think we're moving towards more and more less invasive procedures. And
Hmm.
so, like 20 years ago, there's a condition that dogs get called a patent ductus arteriosus. And it's a vessel that goes between the aorta and the pulmonary artery that's supposed to close at birth. It happens in children as well as in dogs, and less commonly, but it also happens in cats. And what we would do 20 years ago is we would always go in and get a suture around them and close them, ligate them. That's what we call it. Anymore, I would say that the vast majority of those are done percutaneously, and they put like a device into the ductus to occlude it. And so they like go up, say, the femoral artery, go up into the heart, and then pass this device. And so there's maybe just a little incision where they got into the artery, or maybe they even did it percutaneously, and there's not even an incision. What that means for me as a surgeon is that I don't get to do the easy ones anymore. I only get the ones that they, for some reason, can't occlude. The dogs are too small, or they're too big, or somebody tried it and they didn't get it done, and then it, gets harder. Or cats. We do still surgically, and they are much harder than dogs. So it's changing. Like, we are starting to do a lot of things sort of minimally invasively.
And that heart issue, is that something you only see if you were to order an echocardiogram, or do you have other ways of learning about it?
So that particular heart defect, which is the most common, I would say there's a couple that people argue over which are the most common congenital heart diseases. So we divide heart disease into congenital and acquired. They're born with it, or they get it as they age. Patent ductus arteriosus is a congenital problem. So they have it since birth. And they have a really loud murmur. And so a lot of times, just listening to a puppy, the veterinarian will hear a murmur and they'll go, oh, this sounds like a patent ductus murmur. It's called a machinery murmur. And then there are some other things. Their femoral pulses are what we call hyperkinetic or water hammer. They're stronger than we usually see, because when you feel a pulse, what you're feeling is the difference between diastole and systole, or systole and diastole, I should say. And that changes because there's runoff through that ductus. It makes a much bigger pulse pressure, so you can feel that. But when they hear the murmur, they feel the pulses, they say, oh, this looks like it could be a ductus. They're still going to have to get an echo to confirm that diagnosis.
Okay.
And so those cases generally get sent to a specialist to be echoed.
And then prior to that, so you mentioned the spleen, and I've actually known quite a few dogs to have either a mass on their spleen or a ruptured spleen, which I'm sure there's several ways that rupture comes about. But what do you think is causing a lot of those either tumors of the spleen or just enlargements of the spleen? Do you have any information on that?
Yeah, so splenic tumors are unfortunately quite common in dogs. And so we categorize them in a number of ways. So we do see benign splenic tumors. They're like hemangiomas. And then we can see malignant ones called hemangiosarcomas. The hemangiosarcomas they metastasize. The hemangiomas don't. And then the other thing we can see in the spleen is just a hematoma. Any of those can rupture, and the dog may present for bleeding into the abdomen. Hemoperitoneum, we call it. It's just blood in the abdomen because the spleen has ruptured. Generally, it takes going in surgically and removing the spleen and doing a good exploratory to get an idea of what we're dealing with. Unless we actually see metastases in the liver, I would say it's impossible to just tell by looking at the spleen what you're dealing with. So unless you see those mets, we always take the spleen out, send it in for histopathology, get the diagnosis, and that's going to tell us whether we have to worry about additional treatment. So with hemangiosarcomas, what we do know is that we can extend life somewhat with putting them on adjuvant chemotherapy. So generally, if you come see, like me as a soft tissue surgeon, and it's a cancer problem, I'm going to refer to an oncologist to figure out what we need to do other than the surgery. So what
Right.
chemotherapeutic or what radiation therapy do we need to do would most likely benefit this particular case with this particular tumor. I
Hmm.
would do the surgery and then they would do, whatever the follow-up is, the chemo, the radiation,
Right.
whatever.
Okay. And then as far as spleen issues, so obviously you would see those if you were ultrasounding the abdomen for something, maybe an X-ray. Is there any other sign? And I know they're also similar, vomiting, lethargic, but anything to kind of indicate, hey, there might be something going on with my dog's spleen?
Yeah, one thing that you might notice if the spleen has ruptured is that your dog may be pale. I mean, they can
Mm.
bleed a fair amount into their abdomen, so their gums may look pale rather than nice and pink.
Hmm.
Their abdomen, sometimes they have enough blood in their abdomens. Their abdomens are actually enlarged.
Hmm.
They'll be lethargic. They'll usually be anorexic. They'll stop eating. They may not even want to drink. Yeah, they can be very sick,
Hmm.
especially if their spleens have ruptured.
Yeah, that makes
So,
sense. So we've talked about quite a few surgeries. Is there any final surgery that makes this list for you that you see, or just the general practice sees quite common?
yeah. So we focus really on soft tissue surgery because I'm a soft tissue surgeon. Um, but you mentioned when we were talking earlier, cruciate ligament. So
Hmm.
we do a lot of cruciate ligament surgeries in dogs. There's a procedure that is what's commonly done, which is called a TPLO. That means a tibial plateau lengthening osteotomy. And what they do is they go in and they make cuts and they change the biomechanics of the joint so that it's more stable. And because if you don't fix it, once they rupture a cruciate ligament, then their joint becomes unstable. And what follows is osteoarthritis. So the more stable we can make the joint, the less osteoarthritis they're going to develop as they age. So
Hmm.
cruciate ligament surgery, TPLOs are very common.
Hmm.
Orthopedic wise, the other thing would be for hip dysplasia that you
Hmm.
mentioned. People may not know that we do a lot of total hip replacements in
Oh,
dogs.
wow. Yeah.
Yeah, just like people, a lot of them get done. And even bilaterally, so
Wow.
both hips. And not cheap generally to do
Yeah.
that, but it's like it can be like you have a new dog.
Right.
They have really bad hips. Yeah. So definitely worth looking into. And the people who do that surgery do a lot of it and they're really good and they can do
Hmm.
it very quickly. So yeah, if
Yeah.
my dog had hip dysplasia, I would not hesitate to talk to an orthopedic surgeon about whether a total hip replacement was warranted or not.
Hmm. Okay. Yeah, that's good to know. I didn't realize you could just do the total hip. I just thought the changing the biomechanics of any of those joints that might be fluxing might not be stable within those different ligaments and tendons. So that's interesting. You can just do a whole hip, but
Yeah,
yeah.
and that's a big dog disease. So
Uh-huh.
that's why you wouldn't know about it because it's not going to be a Pomeranian issue usually. It's
Yeah.
usually, Labradors, Retrievers, Shepherds, you name it.
Hmm.
But it's the big breeds that generally have the really bad hip issues.
Now, with everything we've discussed as far as surgeries, are there any general prevention tips that you normally give pet owners? And they can be basic. I mean, even the foreign objects. Make sure your dog doesn't eat anything. Better, easier said than done. But like any just general prevention tips that you have?
Yeah, let's think about so one thing we didn't talk about, which is incredibly important, is dental disease in dogs.
Mm,
It's
mm-hmm.
huge. And here we go again. Did you guys know that there are dental specialists, board certified veterinary dentists? That's all they do. And in fact, I have a 4-year-old lab as well as the puppy. And my 4-year-old lab had a root canal done recently because he chipped his canine tooth and we didn't want to remove it. So he had a root canal done and he now has a silver tooth. But yeah, I mean, dental disease is huge in cats and in dogs. Cats get such bad, painful dental disease as they age that, I mean, it's really bad. So the best thing you can do is, first off, you need to see your veterinarian regularly to have your dog's teeth cleaned, just
Hmm.
like you would have your teeth cleaned. They cannot be cleaned without a general anesthetic. So if your veterinarian is not x-raying and not putting them under anesthesia to clean their teeth, they're not actually cleaning their teeth.
Hmm.
So go see a veterinary dentist if that's the case. But the main thing that you can do, and I know this is tough, but the main thing that you can do is brush your dog's teeth. And you need to not do it like once a week. That's not going to help. You need to do it every day. The reason that it helps is that what we get is we get a film on our teeth, and dogs do too. Dogs do. We get this film, and it turns into plaque if you don't remove it right away. So
Hmm.
brushing it will get rid of that. Otherwise, it turns into plaque, and then gingivitis and inflammation, and then that's when you start having dogs lose their teeth.
Hmm.
And you've probably seen, just like I have, a ton of dogs that have had every tooth in their mouth pulled. But
Hmm.
good preventative dental care will prevent that. I cannot emphasize that enough. And I tell you, I know how hard it is to brush your teeth,
Hmm.
but if you do it, eventually what you will find is your dogs like it. Like
Yeah.
you don't want to use human toothpaste, okay?
Right, right.
There's doggy toothpaste out there and it tastes really good. And, once they get used to it, they'll be like, time to brush my teeth.
Yeah. We, and I'm guilty of this. After our dogs get a dental, we're so good at cleaning their teeth. And then it goes to every other day, and then it goes to once a week, and then it becomes kind of non-existent. So I am so guilty of that. But one thing we did, we always had like a toothbrush, but I got they're like little plastic things you slip on your finger and they've got the little notches on them. They're
Yep.
easy to kind of maneuver. And I feel like that's a little bit easier to keep up with than the actual toothbrush.
Yeah.
It might not be as effective as those bigger bristles getting in there, but it's something for people listening. You can get those on Amazon very, very cheap.
Yeah, you can. Those little finger cots, they work well. I was in South Korea lecturing recently,
Hmm.
and I met a company, and they actually had a dog toothbrush that was really quiet. Didn't make any sound really, which I thought was a really nice way to brush your teeth as well. So yeah, there are lots of options out there, but it is important and it is hard to stick with it. I get it, but if you do, you will prevent a lot of expensive dental
Yeah.
treatments as your dog gets older.
Yeah.
So.
And before we wrap up, I know that you have a book on surgeries, right?
Over my left shoulder in that cubby,
Uh-huh.
you can see it's called Small Animal Surgery. So that surgery book is for veterinarians, and I've been doing that book I'm working now on the sixth edition, and it comes
Hmm.
out every 6 to 8 years. So
Oh,
it tells you
okay.
how long I've been doing that book. We did this one just recently, though. This is for pet owners, and it talks about 5 of the most common senior diseases of
Mm.
dogs and how to treat them. And one of the things that we did is when we put this together, we did what would I do if this were my dog? So
Hmm.
I at the end of each chapter, I mean, my dog actually had a lot of these, so that was pretty easy. But
Yeah.
we've got arthritis, we've got dental disease, we've got chronic kidney disease, so it's all in here. You can buy it off Amazon if anybody's interested.
You just described one of my seniors that we rescued when she was 11. She was the mommy dog of a illegal breeding operation. And
Oh,
so she has 2 teeth left and they're completely rotten. But when I got her, I immediately started dentals, but it was too late. We had to pull everything.
yeah.
We've dealt with I'm going to call it doggy dementia. We've dealt with arthritis. Her back is an absolute disaster. Any vet that sees her says, "Can this dog walk?" Like her x-rays are that bad.
Wow.
We've been quoted on every surgery under the moon, but she's 15. She'll be 16 in November. And, she just does her little acupuncture and laser every month. And we focus on supplements and diet. So
Well,
that book will come in handy for the next senior that I have.
well, she's lucky that she has an owner like you
Yeah.
because
Yeah.
it breaks my heart. I read every now and then about people who turn their old dogs into shelters. And I'm like, how could
Yeah.
anybody do that? I just don't understand that. I mean, I don't understand giving up a dog, period. I've never
Right.
done that in my life, never would. But when they're old, you've had them all their life, and then you turn them into a shelter. I just don't get it. But
Yeah. It's awful. It's awful. That's another topic for another day.
oh yeah, yeah, no, that one might make me cry. So let's not do
Right.
that.
Yeah. Well, Dr. Terry, thank you so much for joining us today. This was so informative and helpful,
Oh,
and I know the listeners are going to love this. So we just appreciate you being on.
well, thank you for having me. And my life's goal has been to help animals. So if there's anything I can do, just let me know.
Thank you.
Thank you.
Thank you for tuning in to the Canine Culture Podcast. Please make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media. If you have any recommendations, any topics that you'd like to hear, if you know of any guests that would be good for the show, or if you yourself want to be a guest, please reach out to us. Send us an email at canineculturepodcast@gmail.com, or send us a direct message on social media. Thank you for listening, and please share this with any of your dog-loving friends.